Hi, I'm Annie. Today we'll be discussing about anemia.
What is anemia?
So anemia is a term used to describe a decline in the concentration of hemoglobin of the blood below normal for age and sex. Hemoglobin is a substance that carries oxygen around the tissue for metabolism. It's a combination of hem, iron content, and globin, protein. When there is low hemoglobin levels, the oxygen levels tends to drop, leading to a variety of health problems like shortness of breath, renal damage due to oversecretion of erythropoietin, cyanosis, and even death. It should be noted that anemia is not a disease of its own, but a disease of diseases, a disease caused by a disease mostly at its chronic stages.
Causes of anemia.
The main cause of anemia are 1. Nutritional deficiencies. Deficiency in iron is the most common nutritional deficiencies in the world, with majority found in developing countries. Since iron is a building block of hemoglobin, it will surely cause a type of anemia known as microcytic anemia. Another nutritional deficiency is vitamin B12, which is a coenzyme for methylation of homocysteine, will lead to megaloblastic anemia. The video of iron and its deficiency will be released soon. 2. Chronic diseases. Diseases that can cause anemia are kidney failure, cardiac failure, and infectious diseases, malaria, bacteria and virus infections. 3. Leukemia. This is the neoplasm of the blood cells, primarily the myeloid and lymphoid cells. Now, this may sound like putting a hot dog on a hamburger, but leukemia will induce a kind of anemia known as autoimmune hemolytic anemia, which is a type of anemia caused by the breakdown of the red blood cells via the immune system attacking the RBC. We will talk about classification of anemia in another worthy video soon. So subscribe my channel for more.
Clinical feature of anemia.
So, patient with anemia can present with shortness of breath, easy fatigue, palpitations, angina pectoris, and jaundice. This depends on the causes and its severity. Patient 2 can present with cyanosis, bluish coloration of the skin. Keep in mind about the onset of these symptoms and history taking.
Diagnosis.
It can be diagnosed by full blood count with emphasis on the red blood cells count, erythrocyte sedimentation rate, and more importantly reticulocyte count. The white blood cells can be checked out if it's linked to leukemia. Microscopic findings will help you classify the anemia by taking advantage of the size of red blood cells. Other lab findings can narrow down the causes like serum iron and vitamin B12. Bone marrow can be done too to assess whether the cause is ineffective erythropoiesis. Let's talk about the epidemiology. Anemia of iron deficiency discussed earlier is the most common nutritional cause of anemia worldwide, with majority found in developing countries, but can be felt in developed countries where genetic mutation-induced iron malabsorption can cause iron. Another risk factor to consider is chronic illness, because at the time chronic inflammation, there is always an end stage, of which amongst them is anemia, which boils down to lack of adequate medical services to arrest the disease on time, commonly seen in developing countries. Another point to consider in epidemiology is the environment. They say cleanliness is next to godliness. This applies here as areas where indiscriminate dumping of toxic wastes like iron and other deadly radicals can cause anemia. Lead poisoning has been shown to cause microcytic anemia. Others deadly can indirectly cause anemia in some ways. Thanks for your attention. Share and like this video. We will discuss about the classification of anemia and iron deficiency anemia in another video. See you next time and have a nice day.